Stress is now considered a global epidemic by the World Health Organization, and yet we struggle to measure it. Even before the global recession, the American Psychological Association reported that fully 1/3 of all Americans were extremely stressed, yet we expect employees to do more with less without burning out. And now the Journal of the American Medical Association reports that workplace stress is as dangerous for our heart as smoking and high cholesterol diets, yet most organizations ignore the real costs. A landmark study has even proven that stress and depression cost organizations more than poor exercise, diet, or smoking, and drain vitality, health, productivity, and performance. HeartMath has spent nearly 20 years studying the physiological mechanisms of stress and how to reduce it while enhancing organizational productivity and personal health. We have designed unique programs based on a unique combination of robust scientific research, practical techniques, and innovative feedback technology. HeartMath was introduced into the healthcare market in 2000. The innovation breakthrough came with the release of 3 award-winning computer-based and mobile stress reduction technologies: M-Wave Personal Stress Reliever, M-Wave PC, and M-Wave Mac. The M-Wave technologies are based on heart rate variability, an exciting area of research because of its broad applications to assess overall health, chronic conditions, and cardiovascular fitness. More than 60 research studies have now been published on the effectiveness of HeartMath's programs on chronic health conditions, staff retention, healthcare utilization, mental and emotional well-being, cognitive performance, and even PTSD.
HeartMath provides a great set of tools for our staff to lessen their stress levels, as well as that of our patients. As a self-funded employee health plan, we've been able to buck the national trend and hold down our costs for the past few years. I believe it is due in large part to HeartMath and our integrated medicine program. We've created a partnership with HeartMath and the University of Iowa College of Public Health on a large-scale grant project to study the effects of HeartMath in a variety of community and workplace settings. This exciting project starts this fall.
HeartMath programs combined with M-Wave technologies help individuals reduce stress, improve performance, reach maximum cognitive, emotional, and physical potential, and stay motivated to continue practicing the techniques. Most importantly, HeartMath programs help organizations lower healthcare costs, reduce turnover, improve productivity, lower absenteeism, and improve employee and patient satisfaction. HeartMath programs are delivered in multiple formats, including one-to-one coaching, workshop and webinar blended learning, and full e-learning, web and video-based programs. And they are designed to bring almost immediate results. Employers can measure the impact of HeartMath programs in both the short and the long term. What about metabolic syndrome? Metabolic syndrome is increasingly being addressed by employers facing double-digit health cost increases and an aging workforce. In 2 recent pilot studies, the HeartMath program demonstrated a 59% reduction in the number of people with metabolic syndrome, a 63% reduction in the number of people with elevated blood pressure, a 25% reduction in the number of people with elevated triglycerides, and statistically significant changes in pressures of life, relational tension, stress, anxiety, depression, anger, fatigue, and overall health symptoms. What about staff retention? The cost to replace a nurse is now estimated to be at least $70,000, and the revolving door of nurse and staff turnover threatens patient quality and safety. Delnor Community Hospital saw turnover drop from 27% to 14%, saving $800,000 in the first year alone. Delnor has seen patient satisfaction jump from the 73rd to the 90th percentile, and they are now ranked #1 in the nation in employee satisfaction for community hospitals their size. Swedish Hospital saw turnover drop from 22% to 9%, saving nearly $4 million. Sierra Providence Hospital saw a reduction from 21% to 5%, saving more than $2 million. And Duke University Hospital reduced turnover from 38% to 5%, saving $3 million. Since 2000, HeartMath programs have saved clients more than $12 million just through staff retention.
Stress among caregivers is a significant problem in healthcare. It contributes to errors, significant patient care errors. When I saw HeartMath, I thought that they may have the tools that could help decrease stress among the nursing staff. What happened far exceeded all my expectations. It not only decreased their stress, but it improved their life experiences both at work and at home. It's something that I believe should be mandatory for all employees. It's life-changing for many, including myself.
What about healthcare costs and safety? The Reformed Church in America was seeing a significant deterioration in their clergy health over the last 30 years. Increases in heart disease, diabetes, metabolic syndrome, and depression all pointed to stress as a major factor. HeartMath and the M-Wave technologies are providing a proven solution that can be practiced anytime, anywhere.
HeartMath has become a core component to our comprehensive wellness program, and the results have been extremely positive. We have received a double bottom line: better participant health through decreased blood pressure, less metabolic syndrome, and greater well-being, plus reduced health care cost to the RCA. Over the last 4 years, our average trend has been 3%, compared to the national average of 8 to 11%.
A national retail pharmacy chain was concerned about the impact of stress on error rates among their pharmacists. A HeartMath program with M-Wave technology was introduced to more than 200 pharmacists. Results included a 40% reduction in incidence, with some as high as 71% reduction in errors.
As an employer, I appreciate that our employees can now deal effectively with the stress of our current economy in a healthier way. And as a leader, HeartMath has helped me personally to weather some very challenging times. Many of my coworkers have shared stories of how HeartMath has transformed their lives, contributing to the fact that a recent story in Consumer Reports ranks our hospital 11th best in Iowa for overall patient satisfaction.
In summary, stress is measurable, it is preventable, and we can retrain our system to enjoy the full benefits of health, productivity, and lowered costs. At a time when our world seems to grow ever more chaotic and unpredictable, arming ourselves, our families, and our employees with practical tools is one of the most intelligent investments we can make.